Well, in dental school, they talked about, what I learned was that cavities form from the outside in. But there was an idea that maybe that wasn't so right. And the reason you could see it is because when fluoride was introduced into the population, it made the outside of the tooth harder, just like it was supposed to, but people still got cavities. So what was going on? Well, when you take a tooth and you slice it and look inside, you see that the cavity starts inside, down in those grooves on the biting surfaces of the teeth. If you look down in the groove, the outside can be perfectly intact, but the inside down here, there's a hole. And you don't know it's there. You know, you go into the dentist and, 6 months later, you have a big hole. What happened? Well, it didn't form in 6 months. It was really there. It just wasn't found. So just using a probe to find cavities is probably not enough. We use a laser cavity scanner, and you put a little scan, it scans the laser beam in and reflects back the hardness of the tooth. And you can find them early so that you can find little cavities so you don't end up with big holes and big fillings, which later, you're destined to get crowns and, possibly root canals. If you have a big hole, you get a big filling, after years it breaks down. So we try to catch it early. So the cavity was really forming in the second layer of the tooth, called the dentin. And then when that gets big enough, that's when the enamel on the outside falls off. And that's when you can see it from the outside.